Hello and welcome to this YouTube video on 30 reasons why you've got cramps but no period, according to Ob-gyns. Cramps are a common experience for many people with uteruses, but they can be especially frustrating when they occur without the accompanying menstrual bleeding. In this video, we'll discuss some of the potential reasons why you may be experiencing cramps without a period, according to Ob-gyns. Ovulation. Some people may experience cramps during ovulation, which occurs about 2 weeks before the start of the period. Endometriosis. Endometriosis is a condition where the tissue that lines the uterus grows outside of it, causing pain and cramping. Adenomyosis. Adenomyosis is a condition where the tissue that lines the uterus grows into the muscular wall of the uterus, causing pain and cramping. Pelvic inflammatory disease (PID). PID is an infection of the reproductive organs that can cause cramping, among other symptoms. Ectopic pregnancy. An ectopic pregnancy occurs when a fertilized egg implants outside of the uterus, often in the fallopian tubes, and can cause cramping. Fibroids. Fibroids are non-cancerous growths in the uterus that can cause pain and cramping. Ovarian cysts. Ovarian cysts are fluid-filled sacs that can develop on the ovaries and cause cramping. Stress. Stress can cause physical symptoms, including cramping, even in the absence of a period. Hormonal imbalances. Changes in hormones can cause cramping, even if a period is not present. Interstitial cystitis. Interstitial cystitis is a chronic condition that causes bladder pain and cramping. Irritable bowel syndrome (IBS). IBS is a gastrointestinal disorder that can cause abdominal pain and cramping. Appendicitis. Appendicitis is an inflammation of the appendix that can cause cramping in the lower abdomen. Diverticulitis. Diverticulitis is an inflammation or infection of the small pouches that can develop in the wall of the colon, causing cramping and abdominal pain. Inflammatory bowel disease (IBD). IBD is a group of conditions that cause inflammation of the intestines, leading to cramping and abdominal pain. Celiac disease. Celiac disease is a condition where the immune system reacts to gluten, leading to cramping and other gastrointestinal symptoms. Uterine prolapse. Uterine prolapse is a condition where the uterus falls into the vaginal canal, causing pain and discomfort. Sexually transmitted infections (STIs). STIs can cause pelvic pain and cramping. Musculoskeletal issues. Musculoskeletal issues such as muscle strain or sprain can cause cramping in the lower abdomen. Intestinal obstruction. Intestinal obstruction can cause cramping, nausea, and vomiting. Chronic constipation. Chronic constipation can cause cramping and abdominal pain. Ovarian remnant syndrome. Ovarian remnant syndrome is a rare condition where ovarian tissue is left behind after surgery, leading to cramping and pelvic pain. Vulvodynia. Vulvodynia is a chronic pain condition that affects the vulva and can cause pelvic pain and cramping. Endometrial hyperplasia. Endometrial hyperplasia is a condition where the lining of the uterus becomes too thick, causing cramping and other symptoms. Polycystic ovary syndrome (PCOS). PCOS is a hormonal disorder that can cause cramping, among other symptoms. Ovarian cancer. Ovarian cancer is a type of cancer that can cause cramping and pelvic pain, especially in its early stages. Uterine cancer. Uterine cancer is a type of cancer that can cause cramping, especially in its early stages. Perimenopause. Perimenopause is the transitional period leading up to menopause, and can cause irregular periods and cramping. Menopause. Menopause is the cessation of menstrual periods and can cause cramping as the body adjusts to the hormonal changes. Pelvic floor dysfunction. Pelvic floor dysfunction occurs when the muscles of the pelvic floor are weak or overactive, leading to cramping and other symptoms. IUD. An intrauterine device (IUD) can cause cramping as the body adjusts to its presence. It's important to note that these are just a few of the potential reasons why you may be experiencing cramps without a period, and it's always best to consult with a healthcare provider to determine the underlying cause and receive appropriate treatment. If you are experiencing severe or persistent cramping or other concerning symptoms, please seek medical attention promptly. Thank you for watching, and we hope you found this information helpful.